Welcome to the deep dive. Today we're jumping into Unit 11 from Understanding Pathophysiology, all about the digestive system. Our goal here is to really explore this amazing complex network, how it works normally, what happens when things go wrong, and some specifics about kids too. We'll connect the dots, structure, function, disease, aiming for that big picture without getting totally lost in the details.
Absolutely. And, the digestive system, it's so much more than just food going in and waste coming out. It's this incredibly intricate setup, organs, hormones, nerves, all vital for getting nutrients, fighting off germs, and getting rid of waste. And what's really key is how a problem anywhere along the line can, well, it can have knock-on effects everywhere else in the body. It just shows how central it is.
Okay, let's unpack that. Starting right at the beginning, a healthy system. Let's follow, say, a sandwich on its journey.
Right, stop one. The mouth. And saliva is kind of the unsung hero here. Sure, it's mostly water, but it's got mucus, bicarbonate to fight acid, alpha amylase to start breaking down carbs right away, plus IgA for immune defense. It's really doing a lot. And the flow changes, less when you're resting, more concentrated when you eat, all controlled by nerves.
Then down the esophagus, that tube, about 25 centimeters long, swallowing, that's peristalsis, right? Those muscle waves.
Exactly. It's this perfectly coordinated push.
And it starts voluntary, but then becomes automatic.
Precisely. Upper third, striated muscle, you control it. Lower two-thirds, smooth muscle, involuntary. The vagus nerve handles that transition.
Yeah.
Really elegant.
And at the bottom, there's a gatekeeper.
The lower esophageal sphincter, or LES.
Yeah.
It keeps stomach stuff in the stomach. Its tightness, its tone is regulated by nerves and hormones. Gastrin tightens it.
To stop reflux.
Right. And things like progesterone can relax it, letting food pass into the stomach. It's a fine balance.
Okay, so now we're in the stomach, the churning cauldron, as you called it. Its jobs: hold food, secrete juices, mix it all up into
Chyme, yeah. That's semi-liquid paste. And then propel it onwards.
And the acid in there, hydrochloric acid, it's incredibly strong.
It really is. Strong enough to dissolve metal, yet the stomach lining is usually fine. That protection mechanism is just amazing. The acid itself dissolves food bits, kills bacteria, activates enzymes like pepsin. Produced by parietal cells, these tiny pumps in the lining.
And this acid production starts even before food gets there.
Yeah, 3 phases. Cephalic, just thinking or smelling food gets it going. Then gastric, when food actually stretches the stomach. And intestinal, when chyme starts moving into the intestine, all signal more acid.
So after the stomach's done its part, the real absorption happens in the small intestine, the powerhouse.
That's the place. Duodenum, jejunum, ileum. It's long, maybe 5-6 meters.
And the inside surface, it's not smooth, is it? All those folds and projections.
Exactly. Circular folds, then villi, like tiny fingers on those, microvilli, even smaller hairs. The brush border.
Like velvet, you said, massively increasing the surface area.
Precisely. That huge area is where digestion and absorption really hit their peak.
Yeah.
It's like a super efficient assembly line. Pancreatic enzymes, intestinal enzymes, bile salts. They all converge here. Carbs to simple sugars, proteins to amino acids.
And fats are trickier.
A bit more complex, yeah. Bile salts break them up, lipases digest them, then they form these little packages called micelles. Micelles get fats into the cells, where they're repackaged into chylomicrons.
Chylomicrons, those go into the lymph system, not the blood directly.
Correct. Fats take the lymphatic route. Carbs and proteins go straight into the blood capillaries in the villi, heading for the liver. And the whole thing is coordinated by nerve reflexes within the gut ileogastric, intestinal, making sure the flow is just right.
And finally, the large intestine. Less about nutrients, more about water and waste.
Mostly water absorption and forming feces, yeah. Cecum, colon, rectum. No villi here.
But it still moves things along, that urge to go after eating.
The gastrocolic reflex. Eating stimulates propulsion in the colon. Gets things ready for elimination.
Okay, that covers the main tube. But you mentioned backup. The accessory organs, this is where it gets really interesting, right?
Definitely. The liver, gallbladder, exocrine pancreas, the support team.
The liver, the central processing unit, what does it actually do?
Oh, so much. Produces bile for fat digestion. Metabolizes practically everything. Carbs, proteins, fats. Detoxifies drugs, alcohol, metabolic waste. Stores vitamins, minerals. It's incredible.
And its blood supply is unusual?
Very. It gets oxygenated blood from the hepatic artery, sure, but it also gets this huge flow from the hepatic portal vein.
Bringing all the absorbed stuff straight from the gut.
Exactly. Nutrient-rich, but deoxygenated blood. Straight from the intestines for processing. This dual supply is key. And detox power isn't infinite. Think about paracetamol overdoses as a major cause of acute liver failure. Shows its limits.
It handles bilirubin too, right? From old red blood cells.
Yes. processes it, makes it water-soluble, excretes it in bile. If that goes wrong, you get jaundice, that yellow color.
And bile itself, produced in the liver but stored elsewhere.
Stored and concentrated in the gallbladder, that little sac tucked under the liver.
So between meals, it fills up. Then, after eating,
Especially fatty food, a hormone called cholecystokinin signals the gallbladder to contract, releasing concentrated bile into the small intestine. Helps digest those fats.
okay, liver, gallbladder. What about the pancreas?
The exocrine part of the pancreas is the enzyme factory. Makes enzymes for carbs, proteins, and fats. And crucially, it pumps out bicarbonate-rich fluid.
To neutralize the stomach acid.
Precisely.
Yeah.
Creates the perfect alkaline environment for its enzymes to work best in the duodenum. Another example of great coordination.
And quickly, what about aging? Does the system slow down?
It can, yeah. Things like tooth loss, maybe less saliva, stomach motility might decrease, the gut microbes change. It can all have an impact.
Okay, so that's the healthy system, a beautiful symphony. But now, what happens when things go wrong, when the music stops?
Right, chapter 38 territory. Alterations. And often you see common signs first. Anorexia, just no appetite. Vomiting, constipation, diarrhea, which can be osmotic, secretory, or motility related. These are clues.
And abdominal pain, that seems like a big one.
Huge and varied. Can be from stretching, inflammation, lack of blood flow. We talk about parietal pain, sharp, localized. Visceral pain, dull, crampy from the organ itself.
And referred pain, that's weird.
It is. Pain felt somewhere totally different, but sharing the same nerve pathway, like gallbladder pain showing up in the right shoulder. Classic example.
Okay, let's look at specific problems. Motility issues first. Difficulty swallowing.
Dysphagia can be a physical block, like a tumor or stricture, or functional nerve or muscle problems. Achalasia is a key one. There's loss of nerve function in the esophagus, so the LES just doesn't relax properly. Food gets stuck. Not good.
And reflux, GERD.
Gastroesophageal reflux disease. Stomach contents backing up into the esophagus, often due to a weak LES or the stomach emptying too slowly. Causes inflammation, esophagitis. Can lead to serious changes over time, like Barrett esophagus.
And sometimes the stomach itself moves up.
A hiatal hernia. Part of the stomach pokes up through the diaphragm into the chest. Can definitely make reflux worse.
What about blockages further down, like the stomach exit?
Pyloric obstruction. Narrowing between the stomach and duodenum. Classic symptom is vomiting undigested food hours after eating, often without bile, leads to dehydration, electrolyte problems, and gastroparesis that's delayed emptying without a physical blockage, often seen in diabetes.
And obstructions in the intestines themselves.
Can happen anywhere. Hernias, adhesions from surgery, twisting, volvulus, interception, tumors, lots of causes. Could be a simple mechanical block or paralytic ileus where the bowel just stops moving, often post-op. Small bowel obstructions tend to cause colicky pain and vomiting pretty quickly. Large bowel ones can be slower, more about distension.
Let's switch to inflammation and ulcers. H. pylori seems key here.
Absolutely central, especially for peptic ulcers. This bacterium is fascinatingly adapted. It produces urease, which creates ammonia, neutralizing the stomach acid around it, like its own little protective bubble.
Wow. Clever but nasty.
Right, and it releases toxins that damage the lining. Big factor in gastritis and ulcers, along with NSAIDs.
And the ulcers themselves, duodenal versus gastric.
Duodenal are more common. Often that pain food relief pattern, pain hits a couple of hours after eating. Gastric ulcer pain might be sooner, right after eating, often more chronic.
What about inflammatory bowel disease, IBD?
That's ulcerative colitis, UC, and Crohn's disease, CD. Both chronic inflammation, but different.
UC is just the colon, continuous inflammation.
Usually, yeah. Mucosal layer, mainly. Lots of bloody diarrhea.
And Crohn's can be anywhere, patchy, deeper.
Exactly. Mouth to anus, skip lesions, affects the full thickness of the wall, can lead to fistulas, granulomas, very different patterns.
Then there's IBS, irritable bowel syndrome. Not inflammation, but brain-gut interaction.
That's the thinking now. Altered bowel habits, pain, but structurally normal. Involves gut sensitivity, microbes, stress. It's complex. The mind-gut connection is really strong there.
Okay, back to the accessory organs. When the liver fails, the consequences are severe, right?
Profoundly so. Portal hypertension is a major one. High pressure in that portal vein system, usually from cirrhosis.
And that causes...
Backups. Leads to varices, those dangerously swollen veins, especially in the esophagus. Big bleeding risk. And splenomegaly.
And ascites. Fluid buildup.
Yeah, fluid leaks out into the abdomen. High pressure plus low albumin from the failing liver.
Hmm.
causes that swollen belly, breathing problems.
Hepatic encephalopathy, brain issues.
Toxins, especially ammonia, bypass the failing liver and affect the brain. Confusion, personality changes, that flapping tremor called asterixis.
Jaundice, we mentioned. And cirrhosis itself.
That's irreversible scarring, fibrosis,
Hmm.
often from alcohol, viral hepatitis, fatty liver disease.
Mm.
Liver gets hard, lumpy, cobbly. Blood flow gets blocked, bile flow gets blocked, leading to all those complications.
And viral hepatitis A, B, C, different routes, different outcomes.
You have different transmission, different risks of becoming chronic, but the acute illness often follows phases. Prodromal fatigue, then icteric jaundice, then recovery.
Quickly on gallbladder and pancreas issues.
Gallstones, cholelithiasis, often cholesterol stones, can block the duct, cause pain and inflammation called cystitis. And pancreatitis, acute as dangerous enzymes leak, autodigestion starts, severe pain, chronic, often linked to alcohol, leads to fibrosis, loss of function.
And finally, cancers. They can occur anywhere along the tract.
Sadly, yes. Esophagus, stomach, colon rectum, liver, pancreas. Colorectal cancer is a big one. Risk factors like polyps. And presentation differs. Right side might cause anemia. Left side often causes obstruction, changes in stool shape,
Yep.
different manifestations even in the same organ.
Okay, wow. A lot can go wrong. Now, let's pivot to children. The issues are often different, starting from birth.
Very much so. Many are congenital. Think cleft lipolate right away. Feeding is hard. Or esophageal atresia, the esophagus doesn't connect properly, maybe links to the trachea, causes choking, aspiration. Serious stuff for a newborn.
And in the stomach, that pyloric stenosis, IHPS.
Infantile hypertrophic pyloric stenosis. That muscle at the stomach outlet gets really thick, blocks food. Forceful vomiting, no bile. You can sometimes feel the olive mass. It's the most common surgical issue for infants like that.
Further down, Hirschsprung disease, no nerves in part of the colon.
Exactly. Congenital aganglionic megacolon. That segment just can't do peristalsis. Creates a functional blockage. Delayed meconium passage in a newborn is a big red flag, like a train track with no engine on one section.
What about problems that develop later, not congenital?
Intussusception is a key one. Bowel telescopes into itself, causes waves of severe pain, and that classic current jelly stool from blood and mucus needs urgent attention. And cystic fibrosis, we think of lungs, but the gut is heavily affected.
How so?
A faulty CFTR protein messes with secretions, leads to pancreatic insufficiency, not enough digestive enzymes, causes maldigestion, fatty stools, diarrhea, core growth.
Celiac disease too, the gluten reaction.
Yes. Autoimmune response damages the villi and the small intestine, they get flattened. Major problems with nutrient absorption, lots of GI symptoms, but also things outside the gut.
Malnutrition is still a huge issue globally, isn't it? Kwashiorkor and marasmus.
Tragically, yes. Kwashiorkor is mainly protein deficiency, leading to edema. Marasmus is overall energy nutrient deficiency, severe wasting. And faltering growth or failure to thrive can have many causes.
And liver issues in kids. Jaundice is common in newborns.
Physiologic jaundice is common and usually benign. But pathologic jaundice, with very high unconjugated bilirubin, can be dangerous risk of kernicterus, brain damage. Biliary atresia is rare but devastating. Bile ducts are missing or blocked from birth. Leads quickly to cirrhosis, liver failure if not treated with surgery or transplant. Really highlights how vital those early structures are.
So pulling it all together, understanding the normal function like peristalsis.
Makes it clear why dysphagia or obstruction or Hirschsprungs are such big problems. It's all connected.
And seeing how one thing, like H. pylori,
Can cause gastritis, ulcers, even raise cancer risk. It links different conditions.
the big picture theme seems to be resilience but also vulnerability.
Definitely. And the pediatric side shows how developmental issues create unique challenges. Understanding the why, the pathophysiology, is absolutely key for figuring out what to do.
So thinking about all this, what stands out most to you? Does this deeper dive change how you think about, say, your lunch, or just how amazing the body is?
Thanks for joining us on this deep dive into the digestive system. We really hope it gave you a clear, solid understanding of this vital unit. And a big thank you from the Last Minute Lecture team. We appreciate you being here, learning with us. Until next time, keep exploring.